Good afternoon. My name is Steve Hernandez. I'm the Executive Director of the Legislature's Commission on Women, Children, Seniors, Equity, and Opportunity. I am joined by some special guests for a very important moment in our week. This week is Prevention Week, as many of you may know. And we thought we would take this opportunity to really focus, especially during trying times, the critical role of parents in leading important conversations about prevention. Today, I am honored to be joined by our Commissioner of DEMAS, the Department of Mental Health and Addiction Services. I'm also joined by the founder of the Courage to Speak Foundation. The Courage to Speak Foundation is a nonprofit organization in the state of Connecticut that really is making a huge impact in terms of prevention, not only in our state, but all over the country. I will be introducing all of our guests, but I just want to say that for the benefit of our friends who are joining us on Facebook Live, please tune in, share this discussion. I know that the video will be available after we are done here today live. And also for the benefit of those who are watching on CTN, this video will be rebroadcast and be available on demand for you to share and to watch your family. So without anything further, I would love for us to get started. As I said, I am Steve Hernandez. I am joined today by friends from various ages, from various parts of the prevention tapestry. Firstly, Dr. Delphine Rittman, you as DEMAS Commissioner have really set yourself apart in terms of your agency's efforts in supporting not only historically, but now our statewide efforts at prevention. The way that you have marshaled federal funds for this purpose is really laudable. We will also be joined soon by the Honorable Bob Duff, who's a state senator, Connecticut Senate Majority Leader. Senator Duff represents one of the communities that has been at the forefront of our prevention efforts here in Norwalk, Connecticut. Also, Ginger Katz, the founder and CEO of the Courage to Speak Foundation. Interestingly, the Courage to Speak Foundation was born and raised in Norwalk, and we're very, very proud of the work that they do. Joining us as well as Carlos Reynoso Jr., Bridgeport Recovery Community Center with CCAR, and Nicole Hampton, both of whom are parents. I'm actually going to let each of our speakers introduce themselves, just so that you can see who they are, put a face to a name, and then we're going to go into a very special screening of the Courage to Speak Courageous Parenting 101, which is really a primer on how it is that you can talk to your children. Commissioner, I think you outrank all of us here. So welcome, Commissioner. It's a real pleasure to have you.
Oh, thank you, Stephen, and thank you for inviting me to be part of this panel. It's a pleasure to be here. Again, I'm Miriam Delphine Rittman. It's such an important month, and really appreciate being part of this conversation, and looking forward to our discussion later on. So thank you everyone for joining us on Facebook Live, and as Stephen mentioned, do share this because we'll be sharing really important information about parenting and different resources that are available around the state. So thank you.
Thank you, Commissioner. Next, we are joined by Ginger Katz.
I'm Ginger Katz, founder and CEO of the Courage to Speak Foundation and author of Sunny's Story. And I saw such a silence around the disease of addiction, and nobody back 23 years ago wasn't speaking out. And that's why I named my organization the Courage to Speak Foundation. But I also named it because of the silence people keep inside, the pain they keep inside, and to have the courage to speak because it's okay to ask for help. So we're here today to help, and please join in.
Thank you, Ginger. Welcome, Carlos Reynoso Jr.
Thank you, Stephen. It's a pleasure to be with you all, Commissioner and Ginger and Nicole. And Senator Bob Duff, who I believe just joined us as well. So thank you all. My name is Carlos Reynoso Jr. I first and foremost am a parent, a husband and parent, a parent of 4 children of various ages throughout our Connecticut public school system. And so I'm on here as a parent. I'm on here also as a former prevention official. I was a RAC director, Regional Action Council director at one point. I ran school-based health centers in Norwalk, Connecticut as well, and have done a lot of work around prevention, raising awareness, and spent a lot of time and still continue to do work with Ginger, with this Courage to Speak Foundation as facilitator of her Courage to Speak, Courageous Parenting 101. It's a pleasure to do that. I've been doing that for quite some time now. And I am manager of the Bridgeport Recovery Community Center with the Connecticut Community for Addiction Recovery with CCAR. And we'll get to talk about all of those things a bit later. Thank you again. Thank you,
Carlos, and welcome. Nicole Hampton. Welcome, Nicole.
Hi, thank you, Stephen. It's a pleasure to be here. My name is Nicole Hampton. I'm a parent. I'm also here as a provider. I'm a peer engagement specialist with Norwalk Hospital. And I also sit on the local prevention council in Norwalk. And I'm also, lastly, a woman in recovery from addiction and mental health.
Thank you so much. It's a real pleasure to have you here. And finally, Senator Bob Duff. I mentioned to everyone that you would be arriving. We are now Facebook Live, and we will also be broadcasting on CTN. A very special welcome to you, sir.
Thank you. Thank you, Stephen. And thanks, everybody, for joining us today. And I recognize, I think, most, if not all, the faces here today. And I want to thank everybody for the opportunity to come together and on this very important discussion. Ginger and I worked together, worked with Carlos, and worked with Miriam and Nicole and Stephen and everybody. You know, all these things are really, really important for us. And so it's my pleasure to be able to spend some time with you today and to highlight some of these critical issues for us while we deal with this pandemic. And as a matter of fact, I was just getting off another Zoom with legislative leaders across the Northeast and having some of these very same discussions. So this is an issue that is important for us here, not only in Connecticut, but across really the region and probably the entire country as well. So look forward to the conversation.
Thank you, Senator.
Thank you.
As we know, the work of prevention never stops. And even in emergency, it seems that the work of prevention and the role of parents, family, and community becomes all the more critical. So without further ado, I want to now transition us to our screening of the Courage to Speak Foundation's Courage to Speak Courageous Parenting 101, Parenting Through the Opioid Crisis and Beyond. I will be now moving to the video, and afterward, I'm really looking forward to having a robust discussion with each of you on not only the video, but our statewide prevention efforts. We'll be back.
Hello, my name is Ginger Katz. A drug overdose killed my 20-year-old son. It still feels like it happened yesterday. My son's name is Ian. I found him dead in his room. He was a beautiful, promising young college student, and drugs destroyed his life.
In this 35-minute module, you will learn how the opiate crisis came about and its consequences, learn about youth substance abuse, and understand and practice how you can support the youth in your life to avoid substance abuse and addiction. Courageous parents are aware of what kids are being exposed to. Courageous parents educate themselves and communicate with their children about the dangers and consequences of drug use.
It all started when parents don't imagine their child will ever use drugs. Ian was just in the 8th grade. He was already smoking cigarettes and marijuana. Ian didn't think he had a problem. I didn't have a clue.
Courageous parents teach their child how to manage their emotions. Courageous parents set limits, rules, and consequences for their children.
Courageous parents ensure they do not mistakenly encourage their kids to use substances by avoiding talking about drugs or not paying attention to their child's behaviors. Instead, confront them with a caring and concerning nature when you suspect something. Courageous parents need to guide their children in learning to manage their emotions instead of avoiding their emotions. Furthermore, Courageous parents set age-appropriate rules and limits for their kids and enforce fair and consistent consequences when their kids break their rules.
The U.S. in the midst of an opioid epidemic. The misuse of and addiction to opioids, including prescription pain relievers, heroin, and illicit synthetic opioids such as fentanyl, has become a national public health crisis with devastating consequences that require courageous parenting. According to the National Survey on Drug Use and Health, 1,232,000 youth between the ages of 12 and 17 reported non-medical use of prescription drugs. This crisis requires courageous parenting. Abusing prescription drugs can be just as dangerous, addictive, and even deadly as using street drugs. Recreational use of prescription drugs is a serious problem with teens and young adults. National studies show that a teen is more likely to have abused a prescription drug than an illegal street drug. Prescription drugs, especially pain relievers, can be deadly if taken without a doctor's order and under the care of your physician. And even then, they have to be closely monitored to avoid addiction or other health problems. How did this opiate crisis happen in America? In the 1990s, pharmaceutical companies assured medical communities that less than 1% of patients would become addicted to prescription opioid pain relievers. Doctors began to prescribe opioids at a much greater rate due to pressure from pharmaceutical companies and also patients requesting opioids, leading to widespread overprescribing. As people became dependent on these highly addictive substances, they went to the black market to feed their dependency. When the cost of illegally obtained prescription opioids became too high, people suffering from addiction turned to heroin, which is similar in its effects and was much cheaper.
Addiction doesn't discriminate. It doesn't matter who you are, your wealth, or whether your family loves you. This can happen to anyone.
At first, heroin was often snorted or smoked to avoid needles. As addiction set in and drug tolerance increased, this aversion to needles decreased. Heroin was pure and much cheaper than prescription painkillers, which due to the overprescribing, acted as a gateway to heroin use. Teens, due to the vulnerability of their developing brains, are more likely to overdose, become addicted, or to mix heroin with other drugs. Fentanyl, a powerful synthetic opioid, is being mixed with heroin to increase drug dealer profits. We have seen a sharp rise in deaths in heroin users due to the presence of fentanyl. Marijuana has also played a part in this crisis. 44% of 12th grade students nationally report using marijuana. In Connecticut, 7th through 12th graders using marijuana are 14 times more likely to abuse opioid pain medication and 5 times more likely to abuse other illicit substances than non-marijuana users. The yellow bar in this graph represents how many youth who have never used marijuana used heroin, prescription pain medications, or other illicit drugs, while the blue bar represents how many youth marijuana users have tried these drugs. Marijuana itself has become more potent and dangerous over the decades. THC levels, the psychoactive compound in marijuana that produces the user's high, have been increasing over the years and have been as high as 95% in some marijuana concentrates. Compare that to just 3.7% THC levels only 3 decades ago. Children today are at a much greater risk for dangerous mental health complications due to marijuana's increased potency and can have a serious negative impact on their developing brains. Nearly every teen has friends who claim to be experts on various drugs and alcohol, and they are happy to assure your child that the risks are minimal.
Our kids are getting drug information from the social media sites and pop-up ads. Many of these ads are trying to hook kids on their addictive products. These messages are misleading our kids, who then spread this misinformation to their friends as fact. Every one of our children will be asked to try this pill or use this vape, telling them that it won't hurt you. Parents are the number one key to prevention, so it's up to us to make sure our kids know the truth about drugs.
Courageous parents educate their children about drug use so they get the real facts about the dangers of drugs from you. Most teens who are abusing prescription drugs get them from home, other family members, or a friend's home. Your child's friends could come into your home, open a medicine cabinet, or see meds on the kitchen counter and take them, with or without your child knowing. Make sure the teens in your life don't have access to prescription medicine. Store medication in a locked or otherwise safe place and always dispose of unused medications. Find a medication drop box near you for an environmentally friendly disposal option. Why do young people use drugs, and what is courageous parenting? Teen brains are more vulnerable to addiction than adult brains. The human brain is not fully developed until a person is in their mid-20s. The part of the brain that develops last governs judgment. So teens' brains do not yet have the interconnections to weigh pros and cons and make appropriate decisions, especially in stress-producing situations. If teens don't use drugs during adolescence, they are less likely to develop drug problems later in life. While some kids may start using drugs due to curiosity, if they keep using, it's likely due to either stress from school, peer pressure, family instability, transitions and problems fitting in, or easy availability of drugs and alcohol. Often it's a combination of two or more of these factors. Some kids don't have the social emotional skills to handle problems on their own, so using a drug to escape their pain, anger, or anxiety makes a quick and easy solution.
His father called with a bombshell. Our son Ian was snorting heroin in college. I couldn't breathe. At first I was ashamed of his problem. I couldn't tell anyone. I couldn't find the courage to speak. Then I realized that I only continue the silence that surrounds addiction. I found the courage to address the problems that threaten our children in order to help other families. If we don't address the problem, we're not going to find solutions, and this is why you are here today.
There is a shame or stigma associated with addiction, largely because we don't understand that addiction is a disease. In order to solve the problem of addiction, we need to remove the negative stigma associated with it. When your child is sad, angry, or unhappy, address the real issue. Don't avoid it. Ask your teen to explain the problem to you as they see it. Listen to what your child has to say and listen to how they're feeling. Ask questions to clarify issues and feelings to ensure you understand. Understand and respond to validate their perspective and their feelings, not what you think their perspective or feeling should be. Teens need to be taught to talk with a trusted adult or counselor instead of keeping pain inside, to learn how to handle emotions as part of healthy development, that ignoring problems don't make them go away, and if you see a friend in trouble, tell a trusted adult.
If our kids don't have people they could talk to, they keep their emotions and pain inside, and they may turn to drugs to self-medicate. One of the most important messages kids is to get 3 to 5 adults in their lives they could say anything to. As parents, have that kind of relationship with your child.
There are 4 basic parenting styles. One of them demonstrates caring and respect while providing the boundaries and limits all children need. Which parenting style do you most often use? Consider how this parenting style gives your child what they need from a parent. In an authoritarian parenting style, the parent uses rigid and harsh rules and consequences that can become age inappropriate as the child grows. Teens learn to resist and rebel, and they feel inadequate and unloved. The indifferent parent is self-centered and inconsistent in their parenting. Teens feel insecure, confused by this parenting style, and feel unloved and unworthy of their parents' affection. The indulgent parent allows their child to get whatever they want without having to earn it. The parent has difficulty in saying no to their child. Consequences or limits don't exist or are unenforceable. The indulgent parent wants to be their child's pal, not a parent, and therefore neglects to discipline for problem behaviors. A link has been established between drug use and the indulgent parent. Teens learn to manipulate, become self-centered, irresponsible, and even lazy. The authoritative parent provides age-appropriate boundaries that evolve as the child grows and consistent, appropriate consequences for misbehavior. The authoritative parent demonstrates love and respect for their child while teaching them to have realistic expectations and be responsible for their actions. Teens learn appropriate behavior, that actions have consequences, and improve their decision-making.
As a parent, I need my child to know that I love them and will look out for their health and safety, even if we disagree on what that means. It's my job to be their parent first, not their friend. Since I know and tell my child that drugs such as alcohol, marijuana, tobacco, prescription pain medications, and heroin will harm them, I will set age-appropriate rules for them to help protect them from drug use. And I will fairly and consistently enforce these rules when my child breaks them. But I won't discipline my child out of anger. I'll discipline my child out of love and concern for their well-being.
Youth consistently rate their parents as the most influential source in their life. You can make a difference. Be an active listener with your child. Teens are more willing to work with parents when their feelings are acknowledged. Confirm what you've heard them say. For example, so you felt betrayed when Susan shared your feelings with Tom. See the handout provided for more information on how to be an active listener. Recognize and take advantage of teachable moments. Kids are more apt to talk about drug issues when they feel the topic is not forced but comes up naturally. So look out for teachable moments. Opportunities arise in everyday life. Use them as a time to talk with your child about drugs and alcohol on a regular basis. Make it a normal part of your family's discussions. Examples of teachable moments include a TV show, movie, or social media refers to drugs. They had health class. Ask what they learned. Drugs mentioned on the car radio, news, songs, etc. A friend or neighbor is struggling with an addiction problem. Teen drug ads on your child's social media or TV. Break the silence. Kids are faced with redeciding about alcohol and other drug use every day. Talking about substance abuse should start in early grades and continue through the college years and adulthood.
As a parent, you have to find out everything your child will be exposed to, even if you think your child will never use drugs. Educate your child and remember that the number one key to prevention is a parent who regularly talks to the child about the dangers of drugs.
Spend time around your teen's friends, like driving to and from activities, chaperoning social events, and host friends in your home. Make sure their parents are aware of your anti-substance use values and are able to support them. Parents must be the example and set the example for their children. Let them know that you will be checking in advance with the party host to ensure it will be a safe and drug-free environment. And let your child know you are available to pick them up if drugs or alcohol are at the party. Be awake when your child comes home. Don't assume your child will be getting home safe or in a healthy condition. Be home to greet them. Enforce curfew. Give them a hug and kiss to smell their breath for alcohol and look directly into their eyes to check for signs of substance abuse. See if they have bloodshot eyes. Your teens may test and bend the limits, but it's up to you to keep them safe.
Teen parties are perhaps the most common place where youth are using alcohol or other drugs, mostly without adult permission, but sometimes with adult permission. As parents, we need to protect our kids from uncomfortable situations and peer pressures to use drugs. When your teen is going to a party, call the house where the party will be in advance and talk to the parents. Ask them if they'll be home during the party, if alcohol or other drugs will be present, and if they'll be supervising the party to ensure a safe, drug-free party. If you don't receive the assurances you're looking for, tell your teen they can't attend the party. Encourage the other parents to check in with you if there is a party at your house in the future, as sometimes teens will try to have parties without permission when parents are not home.
Negative information is widely available on the internet, including pro-drug information. So parents need to monitor their child's use of electronic devices and all of their social media accounts. Many servers offer a service where you can block the sites you don't want your child or teen to view.
A lot has changed since Ian died. The internet and online social media exposes your child to what used to be unimaginable dangers. It's critical that parents plug in and gain some social media and internet skills so they can monitor their child's use of the internet and help them through this vulnerable time of their lives.
Know how many pills you have, especially pain relievers and mood-altering drugs. Secure the medication in your home by locking them up. Properly dispose of all medications after their prescribed use. Do not keep unused medications in the home. Inform your relatives and friends' parents to follow these same precautions as well. You can find a safe medication disposal drop box in your Connecticut community by visiting www.drugfreect.org. Be honest and clear with your child when you don't trust their behavior or decision making. Tell them you love them and it's still your job to protect them. Their health and safety is your primary concern. Be prepared to explain what the current problem is and what they can do to earn your trust in these situations. Teens need you to be their parents, not their pals, more than ever. Teens still need to know that as parents, you'll still look out for their health and safety. Most younger kids know alcohol and other drugs are not good for them, so be a positive role model for them. Teens who believe parents would strongly disapprove of their substance use are less likely to use drugs. So letting children know you disapprove of substance use will help them make healthy decisions.
I think one very helpful thing is to not be afraid to start a conversation, not to be afraid to look for the signs, and to realize your role as a parent isn't necessarily to be your child's friend, and it's our job as parents to protect them from this horrific, deadly disease.
Practice refusal skills and responses with your preteen and teen. Role-play exercises that foster communication and support. Secure a commitment from your child to use these refusal responses when offered alcohol or drugs. Let your child come up with their own responses. Offer help if they need it. Tell your child they can use you as an excuse. For example, if my dad catches me, he won't let me go to band for a month. Explain that friends who offer them drugs are in their own pain and need help, not more drug-using friends. See the handout provided for more information and scenarios that can be practiced in teaching refusal skills. Tell your teen that their health and safety is your responsibility. Tell them they can trust you to do whatever is necessary to protect them. The tendency of a teen is to hide a substance use problem, so if you become concerned, go with your gut instinct and investigate further. Talk to them about your observations and concerns, and let them know that you will do whatever is necessary to protect them from drugs and alcohol. Talking about the dangers of drugs does not make your child more curious to use drugs. The opposite is true. The earlier you talk to them, the earlier they know this is important to you. Keep yourself informed. Drug information is changing all the time. Stay informed on the latest trends in this constantly changing epidemic. The tendency of a teen who uses drugs is to be secretive. So if you detect anything, don't think it's their first time using. There's a good possibility they have been using for a while. Talk Talk to them about your concerns and that you will do whatever is necessary to keep them safe. Tell your teen that their health and safety is your responsibility, and they can trust you to do whatever is necessary to protect them, and that if you suspect alcohol or other drug use, you will investigate.
As parents, we need to continually make our role clear to our teens as they seek to become more independent. Remind your teen that it is your responsibility to keep them safe and guard their health. This means you'll do whatever is necessary to protect them, including from drugs, since they're so dangerous to the developing teen brain. Be proactive with your child. Talk to them before they become teens about dangers of alcohol and drugs to their body and brain, and that it's your job to protect their health. Continue this conversation with them throughout their teen years. Most importantly, remind them that you're doing this because you love them.
Have dinner together as often as possible with all electronic devices off. 3 and 4 teens say their parent is the most influential person in their life. So use your power to stay close to your child as they grow and protect them from the harms of drug use.
Need help right now? Call the Courage to Speak Foundation at 203-831-9700 or call the Department of Mental Health and Addiction Services helpline at 1-800-563-4086.
Our Courage to Speak Foundation gives parents and students the tools to do this. This really is a family construction project, building a safe place to find the courage to speak.
That's great. Thank you all so much for taking part in our screening of Courageous Parenting 101. You know, I've seen that screening, or I've seen that module several times. The module is available at couragetospeak.org. And every time I see it, I feel like I learned something new. But what's really compelling about this particular screening of it is that it really shows the importance of leadership, the importance of information, and the importance of clear and consistent guidance, not only for us as adults, but also for young people, for children. So I'd like to now turn to our esteemed panel. I am going to go to our leaders because you must now know, especially after screening the video, why you're here. You are among the biggest supporters, not only at the state level, but also in your communities of these efforts. And for that, we thank you. I do want to turn to our parents first. And, you know, first, Nicole, I want to hear from you as a parent, as a professional. Why is this training important to you?
Well, first off, as a person in long-term recovery and a parent, you know, of a young child, it's so important to be able to like recognize the behavior and the signs, and to be able to like, you know, switch it around and have the resources available. So this program has really taught me skills and gave me the tools to use to help me parent, you know, through this.
Thank you, Carlos. I pose the same question to you. You know, why is this important to you? And is there something about the times we're living in now that make it more relevant? You could just unmute.
Of course, I have to unmute myself first. So thank you. That's a great question. And I know, just to kind of echo what Nicole says, you know, first and foremost, as parents and also as a professional, but as parent, important because we need some type of formality or structure, some type of guidance, some guideline, something. And Courage to Speak has a curriculum, not only this presentation or this piece that was created, but the curriculum that exists and everything that goes along with it. I know Sunny Story has been a great help in having children understand a little more about addiction and substance use disorder and the effects, right? The impact it has on not only the individual, but the family. So I think it's a great, as you can see, a great family friendly, curriculum and video. And for me, it's been great as a parent, professionally speaking, and I have the pleasure now and for several years now facilitate the training, the Courage to Speak Parenting 101 training. It's been a pleasure to do it and to get the reaction statewide and even outside of the state, opportunity to go to Boston, Massachusetts and share this as well, is that, again, it's something that families can turn to. A lot of times people go to Google, they'll go to YouTube, but we are here to tell you that you don't have to, you can, it's one-stop shop. You can really get a lot from the Courage to Speak because of the different pieces to it, curriculum and presentation and Sunny Story. So that's been helpful, and I think it's a great tool.
Thank you, Carlos. Ginger, if you could share with us, we've known you, we've worked with you, Ginger, for many years, but you created this tool, not on your own, but with the help of experts and others. Tell us a little bit about what led you to create this tool. What was your motivation?
Basically, I wanted to break the silence around addiction. And when Ian died, I sat on his bed the morning he died, and I said, what went wrong here? We were good parents. You don't have a toolbox. And Ian died 24 years ago. That was really different back then. There was so much silence about it. Nobody talked about their child that's smoking pot or drinking or using any other drug. And, it was the night before the funeral, and I couldn't sleep. I held a lot of young women in my arms who wore long black dresses at the wake, and they were wondering what happened to Ian. And we were telling people, we're waiting for the toxicology report. We just were stymied. We just couldn't speak. And, but we knew. You see, the doctors told us to tell people that Ian died of an aneurysm or a heart attack, and that wasn't the truth. And as I lay there, just before the funeral the next morning, it was 2 o'clock in the morning, I knew I couldn't put one foot in front of each other. I knew I couldn't bring myself to the funeral, physically, emotionally, and spiritually. So I woke my husband up and I said, Larry, I can't do this. And he held me and we cried. And he fell off to sleep. But then I visualized speaking out. Sometimes I wonder where it came from, and maybe I don't. So I woke him up again and I said, Larry, I want to speak out. I said, if this is happening to us, it's happening to other families. I never lied about my son, Ian. He was a good kid. He made an unhealthy decision to use drugs, and I wasn't ashamed of him. It would have been irreverent not to speak and tell the truth. And I knew that if this happened to me, it was going to happen to other families. And the next day we went to the funeral and buried our beloved son, Ian, and we started to speak out.
Thank you, Ginger. The courage to speak is really the courage to take a tragedy such as the one that you experienced and really paying forward what you learned from it. And Commissioner, I turn to you because leadership matters, and also finding ways to support this work during good times and tough times is something that is so important. So I'd love to hear from you. Why is this important to Demas? Why is it important to support this work?
Yeah. This has been such an important initiative for us. And Ginger, I just want to thank you for your work and for your commitment to sharing your story, to helping to break down stigma and to let people know that, that it's okay to talk about addiction and what families experience. And to let people know that there are tools out there. There are tools out there where parents can learn how to have courageous conversations with their kids. And so for me as commissioner, it was really important to support this. And this has been an ongoing, really, collaboration, but to continue to support the Courage to Speak Foundation, because we know that stigma is out there, it's real. and that it's important for people to know that they can come out of the shadows, that if they're struggling, they don't have to struggle alone, that there is support available, and recovery is real and recovery is possible, and that parents can play a really valuable role in helping their kids to say no to drugs and live healthy lifestyles. And so this work really helps to keep it real and to let parents and family members know and young people know that it's okay to speak and it's okay to come out of the shadows, and that courage is important. And so I appreciate our collaboration.
Thank you, Commissioner. You know, I think it's no accident that Norwalk is so well represented in our little Brady Bunch panel here today. I think part of the reason for that is that there are so many centers of gravity in our state, not only of addiction, but also of hope and of help. As the state senator from Norwalk, Senator Duff, you've been a huge advocate locally and at the state level for this work. Tell us why this is important for you as a leader.
Thanks, Stephen, I appreciate it. And again, I want to thank everybody who's on this panel today. Everybody has a lot to do and time is short, so taking some time out for this is really important. And actually one of the first meetings I ever had when I first was elected was with Ginger and Larry Katz. You probably remember coming to my real estate office and talking to me about the courage to speak. And that to me was really important for a couple of reasons. One of which is because I really give Ginger a lot of credit for having the courage to speak out when most parents would really just go inward and worry about themselves. And Ginger, through this tragedy, understood that she could help a lot of people by speaking out and speaking up. And so that really, I know that she has helped save lives, countless lives all across this country. And so that to me was huge. And two, the fact that, I had small kids at the same time that she was talking about a lot of this stuff. And so I wasn't just listening as a legislator, I was listening as a parent and trying to also figure out myself, what kind of messages do you put out there? How do you do it? What are the signs you got to look for? As somebody, I think it was Ginger said, or maybe the commissioner, there's no, you just don't get that handbook when your kid's born, and you just do the best you can a lot of times based on how you were raised yourself. And I had good parents, and but times change, and you want to make sure you're doing the best job you possibly can. So being able to support Courage to Speak and Ginger and Larry and the work that they do has been important because kids get messages in a number of different ways, and these are some of the ways in which kids can get the right messages and can learn and can do it in a way that they can understand.
Thank you, Senator. You remind us, and so many of you on the meeting today remind us, and folks watching on Facebook Live, each of you is doing the best that you can during this emergency and continuing to do the work that you do in your everyday lives. But so many of you are also parents, and you were parents before this emergency, you're parents now, and what's so relevant about this is the role of parents and the role that parents play in leading on behalf of their children. Nicole, if I can turn back to you, one of the things that is really striking for me is whenever we have a conversation about prevention, we hear very, very clearly, what about intervention? How do we get to the people who are suffering now? And then we hear very clearly, what about recovery? So I'd love to know, this, the Courage to Speak really focuses a lot of its efforts on prevention, but why is this work also important for recovery?
Well, I'd have to say, since the disease of addiction, they say, can be hereditary, I definitely pay attention to all my daughter's behaviors because I recognize mine, and I can recognize the same ones in her. But the Courage to Speak gives me the tools, right, to role play with my daughter. I never thought before doing this training, should I ask my daughter what she would say if she was offered drugs? And now we like talk about that on a regular basis. And, during this pandemic, there's a lot of isolation, right? And I tried in the past to like monitor her screen time, but it's kind of hard, being that everything's online now, but I definitely pay attention to what she's looking at online, and I'm constantly educating her on the dangers of drugs and the consequences.
Thank you, Nicole. The same question for you. I'd like to remind our viewers on Facebook Live that we have just had a screening of Courageous Parenting 101 from the Courage to Speak, which you can find at couragetospeak.org. Carlos, same question to you.
It's important. I got to tell you that it's important to recognize or know that we are in this middle of this pandemic. We have an epidemic. And I think it's important to understand that just last night, and I want to acknowledge this because it's national news and it's news to us as parents, but artist and musician Melissa Etheridge, just last night at 21 years of age, she lost her son at 21 years of age to an opioid overdose. Hopefully, as Ginger has, she would help us join in the front in regards to being courageous to speak on it. She has already on her social media, and I hope she continues. So to make it real, right, to you all and to everybody listening, I should say, and watching, is that we have an epidemic in the middle of a pandemic. And so our children, as well as adults, are struggling. This is Mental Health Month as well, right? So just noting that it is important to note that folks are going through a lot of different emotions during this pandemic, which can, and you touched on, you mentioned recovery. And so in recovery, we have, that is a very vulnerable population. And we have individuals that I see on a daily basis, and now we see them with the pleasure of seeing them virtually in Zoom meetings and listening to them on telephone recovery support calls, that they're struggling. It is a very trying time for everybody, and specifically for those that have struggled with some mental health. And of course, in recovery from addiction, from substance use disorder. So it is important to note that we have groups of folks that are much more vulnerable at this time. Just like we look at the pandemic and looking at the vulnerable, our older adults being vulnerable, or now we're finding out our children are also vulnerable to this virus. We have to understand, right, and just acknowledge and recognize that because of this pandemic, folks are struggling a lot more. And so we're here to assist, and not only through prevention with the Courage to Speak Foundation, but the other hat that I wear with the Connecticut Community for Addiction Recovery, Managing a Recovery Community Center. And we're here to help. I'll talk about resources a bit later.
Thank you. We are receiving questions from some of our live viewers. One of the questions that's been repeated a couple times is about age appropriateness for some of the work that the Courage to Speak does. As you said, Carlos, the video is a module which is kind of a primer of really what is an entire curriculum that is funded by the department and through the work of Ginger. Tell us about age appropriateness, either Ginger, Nicole, or Carlos. How accessible is this for kids of different ages?
Would you like to comment, Ginger, first?
Sure. We started out, I visited the superintendent of the Norwalk school systems, and he was brand new, and Larry and I visited him and said, we'd like to develop a curriculum with a team of experts. I have it all lined up and I have the funding for it. And he looked at us and he realized that this was really important. He gave us, he brought in a lot of advice from the principals, and they said, go ahead, sure. She's been speaking in the schools for 10 years, 15 years. This is great. So we selected the middle school to develop the first Courage to Speak Drug Prevention middle school program. It was a hit. Kids wrote letters to the newspapers, and it was fun for them, and they learned a lot. And a lot of children don't think it could happen to them. They don't think a sip of beer, pot, cigarettes will lead to other things, but our children's bodies are still growing, and they get addicted very rapidly. It takes 10 years for a 30-year-old white male to get to the chronic stages of alcoholism. It takes fewer than 15 months for a child. It's very rapid. So we started in the middle school, and then superintendent of school said, well, what about the high school? And then we developed the high school program with the same idea. And there's social learning skills, social and emotional learning skills, which covers a lot of skill building lessons, resiliency skills, and so on and so forth. It's not just about a drug, it's about their feelings and how they cope and so on and so forth. They're very strengthening lesson plans. And then I was sitting on the deck one day and I looked at my dog, Sunny, and I said, Sunny, if you could talk, you had a lot to say. And a light bulb went off and I wrote the book from Sunny's perspective. Sunny found Ian and tried to wake me up the night before Ian died. And I thought years later, if Sunny could talk, he would have a lot to say. So I got together the team of experts again, and it was amazing how they all came to me to help us out. And it's based on a book, Sunny's Story, and it has a 9-lesson plan. And the curriculum for the middle school has 13 to 16 lessons. It's like a smorgasbord. And the national and state standards are 12 lesson plans for the middle school. And the high school has about 11 lesson plans. So it's a toolkit. It's a family construction project, but it's a toolkit for both parents. The number one key, as we all know, is the parent talking to the child about the dangers of drugs. And only 1 in 3 parents do this in our country. It means 2/3 of kids going to school every day, they don't have this conversation. So what are they learning? So this I knew, and I found out many things after Ian died. That's it.
Thank you, Ginger. You know, the first time I experienced your curriculum, I thought of it as a school, family, and community approach to prevention. And, you know, the community part of that is so critical. Nicole or Carlos, talk to us about the role of community and working together with families on prevention.
Go ahead, Nicole. Would you like to go?
Well, I was going to share a little bit about being a parent and this being very age appropriate, because I actually started teaching the Sunny Story to my daughter when she was in 5th grade, and she's now in 6th grade at Norwalk Public Schools. And they don't get the curriculum until 7th grade, but I think it's very age appropriate for well before 7, because I feel like if my daughter can learn about sexual education in 5th grade, she can also learn about addiction.
Very true. And again, I just want to echo a lot what Ginger and Nicole mentioned, but also to share that, you know, I think it's important for our viewers to know, those listening, watching, that this is based on a young person's brain. So its brain development is key here, right? When we're talking about, you know, obviously using or abusing a substance. And with that being said, it's important to note, so we're looking at all the lifespan up until the age of 24. Brain is usually fully developed by about the age of 24, 25. Of course, case-by-case basis in some individuals, male, female, but to be, I'd like to just say that there is one industry that has it based on research in regards to what they offer customers, but the car rental companies do not rent a vehicle to anybody under the age of 24, 25. And that's for a reason, based on brain development and liability, of course. So if your brain's not fully developed, then we don't want to be liable or know that you're going to destroy our product or our vehicle, potentially, right? Because you're at risk or higher risk. So with that being said, I think the understanding here, and when we roll out and facilitate the courageous parenting, we educate parents around the fact that it's because of brain development, and we don't want to alter, we don't want to, unfortunately, cause something that will cause somebody their judgment to not be one that, and of course, making the wrong choices. So again, a lot of it has based on also brain development, and that's important to know, especially when we're talking about, for example, which can be controversial, marijuana, right? So we can talk about somebody who's 30, 40 may have a different, there's different perspectives of age. But under the age of 25, a person's running a high risk of becoming addicted to other drugs as well.
Thank you, Carlos. And, you know, as we're receiving more questions from parents, and one of the questions that has popped up a couple of times is, given the current emergency, some very difficult decisions were made in the interest of public health to close many establishments in the state of Connecticut. One of the ones that remained open was liquor stores. Why is that?
Carlos.
So I know this question's come up a few times, and we understand that the governor and the administration, including his task force, the order was to keep the alcohol outlets open. I know Nicole can touch on this as well with the work that she does, but it is actually dangerous to close outlets. Alcohol outlets, because those that are in recovery, those that may be using actively, can actually suffer deadly withdrawal symptoms, right? Fatal withdrawal symptoms. Not to mention that the increased number of emergency department admissions would increase tremendously, putting them at risk. We know for the virus, as well as really adding more work at this moment to our medical staff. So it is important to note that it's such a debatable topic or question. It's a great question because yes, we understand access is an issue, right? We talk about that in prevention. Having access to a substance is a problem. However, we are hoping and always that our alcohol outlets are checking for age requirements, right, over the age of 21. But it's to tell you that from the work that both Nicole do as well with addiction recovery, it is very dangerous. And Nicole can obviously tell you a lot more from working directly in the emergency departments.
Yeah, at first I was outraged as like a woman in recovery that the liquor stores remained open. But being educated in the fact that, you'll suffer extreme withdrawal symptoms and you could die from alcohol withdrawal, I understand why, it's essential. And I just think for those that are in recovery, you just have to stay connected with, your whole support system so that you don't access those the liquor stores.
Thank you for that, Nicole. You remind us why it is so critically important that these decisions be made with the right information. And I learned something today that I didn't know. I didn't know that it was actually a risk for people to lose because of the power of addiction, to lose access in a very what we call in terms cold turkey way could really bring a risk not only to the person but also in spreading this disease. So thank you for that. I bet a lot of parents didn't know that. As we start to come up on the hour, I want to give us each an opportunity to wrap up and to provide some parting words for the families and parents who are listening. I'll start with our commissioner, Commissioner Delphin Rittman.
Yes, thank you. Yeah, so, for the families and parents that are listening, I encourage you to check out the video. It allows and presents wonderful resources and tools around having courageous conversations. It helps to let your kids know that you care, that you're listening, that you see and want to know about their struggles and about their friends. And ultimately can help to reduce stigma by having conversations with kids, and can help to normalize these types of conversations as well. Letting kids know that it's okay to talk about their struggles, and families to know that it's okay to talk about substances, that recovery is real and services and supports are available. So thank you.
Thank you so much, Commissioner, and thank you. And as reminded by Senator Duff's words, these are busy times, especially for the two of you. But thank you for taking time on behalf of parents for being here today. Senator Duff.
Thank you, Stephen. I appreciate it. Thanks for putting this together and the work that you do on the commission. I do want to give a shout out to Commissioner Delphin Rittman for taking the time to be here, because she is going 24/7. I doubt she's taking a day off, and I doubt that she has 2 minutes to herself. So on behalf of myself and everyone else, we appreciate the work that you're doing with Department of Mental Health and Addiction Services, and we appreciate your good work. So keep it up, and thank you for that.
Thank you, Senator Duff.
You're welcome. I just also wanted to mention too that, these things, part of the strategy on reopening is it's a delicate balance, because we know that the more you open, the more positive cases you're going to have, potentially the more hospitalizations. But you have to balance that out towards some of the other needs that are out there. Obviously, there's the economic needs, but there's also the mental health needs. There's also the physical health needs. There's needs for our children. There's needs to ensure that children who are experiencing child abuse or people who are experiencing domestic violence, are able to leave their homes and see people or talk to people if they're not able to do so. So that's why I think events like this are important. And as we talk more about reopening and other ways in which we are going to try to get ourselves to whatever the new world order is after this, these kinds of conversations still are very, very important, because kids are having a very tough time, adults are having a very tough time, and the more that we can put this out to the general public, the more that we can speak about this, the more that we can bring some light in, I think the better. So I really do appreciate what you've done, Stephen, and Carlos, who I've known a long time, and Nicole, thank you so much for your words and your good work, and Ginger, of course, for being the really springboard for all of this. We appreciate it. And again, thanks for having me on today.
Thank you, Senator. Nicole.
Yes, thank you so much for having me. And for all the parents and everyone, listening, watching this, definitely stay connected. Check out the training and the great resources on Ginger's website, and talk to your kids. It's okay to talk about it. And the more you educate them, the better off, the more prepared they'll be for, real world.
Thank you. Carlos, as I turn to you, I want to put you on the spot one more time. One of the questions that we got is, we would love to have this resource in Spanish or other languages. Tell us a little bit about that, how we can do that together.
Thank you, and I appreciate that question. Yes, so we do have the curriculum, or I should say this presentation has been done in Español también. So we can do it in Español and Spanish, right? And we've done it. We've rolled it out in Stanford. We've done it in several different places. Ginger and I have co-facilitated the Courage to Speak Courageous 101 presentation out in Spanish. Also, there are resources in Spanish, and I want to make sure that we mention the fact that the Department of Mental Health and Addiction Services and the Commissioner's on has resources as well, a lot of links on their website. The Connecticut Community for Addiction Recovery also has telephone recovery support. For those, you don't have to necessarily be in recovery. Sometimes people are a little shy and say, well, I'm not in recovery, but you're seeking recovery, right? Telephone recovery support is for you as well, or for your loved one, right, that you're concerned about. So they can sign up through our website. And of course, Ginger's website is important in regards to prevention, but those seeking recovery is www.ccar.us. And you can get on there, sign up for telephone recovery support in English and in Spanish, and as well as the virtual all recovery meetings that are being done 3 times per day, once also on Saturday and once on Sunday. And we have a meeting in Spanish as well on Thursdays, and one in sign language on Tuesdays. So we really have listened to the public, to the residents of Connecticut and those that join us also from other states on those meetings. It's a beautiful thing to see, because as we know, addiction does not discriminate. And so we get folks, the other day we had somebody from Japan that was on one of our all recovery meetings, and other folks from across the country. So happy, and just for folks need to know that we're here and we're here to support.
Thank you, Carlos.
Thank you.
And last but not least, Ginger.
You'll be last, Stephen. Stephen, I want to thank you for supporting me through the years, and everybody on the panel. You're not only professionals in the field, you're parents, and you're my friend. And I'm so lifted by this. And to the listening audience, if your child is exhibiting any kinds of signs of drug use, if you see it, please interact with him or her right away and get help. Addiction does accelerate. That's because our children's bodies are growing. And that's what I can say. Get help right away. We're all available. We all work in different offices, but we are all available. There's a hotline for Demas and Miriam. Do you know that? Does anybody have that?
800.
Yes, yep. So it's 1-800-563-4086. So again,
help right away.
1-800-563-4086. And if anyone calls that, they can receive an assessment. If they need a ride to detox, we'll give them a ride to detox as well. And there are many different resources. Also, if you look up Demas COVID-19, there's a range of different resources, including virtual groups for young people. Smart recovery, smart recovery groups.
When we post this video, Commissioner, we'll be posting some of your links as well, and so that people know where to go, both for what we can find in various languages at the department, but also at Courage to Speak. So to our listening audience, parents that are listening, and for each of you, I would really like to thank you on behalf of the people of the state of Connecticut for continuing to have the courage to speak. Thank you all very much, and we'll see you again soon.
Thank you.
Thank you so much.
Thank you for convening us, Stephen.